If you can go to the next slide. Good afternoon, everyone. My name's Lisa Collison. I'm the General Manager of Research and Innovation here at APNA, and I'd like to begin today by acknowledging the traditional owners of country throughout Australia to their continuing connection to land, sea and community. For me, I'm on the Wurundjeri Woi Wurrung and Bunurong people here in Melbourne, and I pay my respects to them, their cultures, to elders past and present and emerging, and to any Aboriginal or Torres Strait Islander peoples with us today. Next slide, thanks. So, welcome to today's webinar, and thank you all for joining us. I'm glad that you could make it to this second webinar on the primary healthcare nursing workforce. We've had a great turnout for the first webinar in which we discussed insights on what nurses do in their daily practice and the enablers that affect utilisation. The need for nurses is growing, and what is Australia doing to meet these challenges of demand, supply and retention? In today's webinar, I look forward to introducing you to speakers who will discuss the National Nursing Supply and Demand Study, which forecasts the supply and demand for nurses in Australia over the next 12 years, give you some insights we've gained from our national annual workforce survey that affect retention and as well solutions to grow and support the nursing workforce. So before we get to the presentation, I'll just briefly cover off all the administrative elements of the webinar. There'll be a Q&A session at the end of this. You can submit your questions in the Q&A function on the right-hand side of your screen, and we'll attempt to respond to them, as many of them as possible at the end. For questions that we might not get to today, we'll publish answers on these on our website in the next couple of weeks. And as there's no option for you to turn on your video or microphone, this session is being recorded and will be published on our website in the coming days. Next slide, thanks, Danny. So APNA. APNA is the peak professional body representing over 98,000 nurses and midwives in Australia who work outside of hospital settings. Globally, we know that nurses and midwives are the largest occupational group in the health sector, and in Australia, the 2023 national data puts us at over 391,000. I'm sure, Sam, you might have an updated number on that. I think we had something quoted as over 500K in our last webinar. So combined, nurses and midwives make up 54% of Australia's health workforce, but they don't all work in hospitals. And our workforce survey shows that there are over 26 different areas, including but not limited to those listed on this slide. So next slide, thanks. Danny. So firstly, I'd like to introduce Sam Lavender to discuss the National Nursing Supply and Demand Study. Sam is an RN and a Health Policy Officer in the Commonwealth Chief Nursing and Midwifery Officer Division in the Department of Health, Disability and Ageing. This role sees Samantha providing policy advice on complex matters pertaining to nursing, the health system, health workforce, regulation and education. Sam's diverse career spans across the public, private, not-for-profit and government settings in the health and aged care sectors. She's a member of the Australian Medical Assessment Team and the Global Outbreak and Alert Response Network, completing deployments for significant health events. Her contributions in these roles highlight her commitment to health challenges on both national and global scales. So welcome, Samantha. Next slide.
Thanks, Lisa, and thanks for having me along today. It's a privilege to speak to you all. Before I begin, I'd just like to acknowledge the traditional owners on the lands on which we're meeting from today. For me, that's the people of the Yugambeh language-speaking region, and pay my respects to elders past, present and emerging, and extend that acknowledgement and respect to any Aboriginal and Torres Strait Islander people on the webinar today. So I'm Sam, And I'm going to talk a little bit about the supply and demand study and how that contributes to building the nursing workforce of the future. So improving the supply, retention and distribution of a quality nursing workforce is critical to ensure that all Australians have access to health and aged care when and when they need it. So improving the supply, retention and distribution by looking at trends and changes in Australia's population, it is possible to forecast how many nurses are needed in the future and to consider where those nurses are most needed based on location of the population and health outcomes. Identifying potential gaps through workforce planning projections, such as the Nursing Supply and Demand Study, provides governments and professional bodies like APNA, employers, regulatory bodies and higher education and training providers the opportunity to develop and implement plans to minimise any gaps. Next slide, please. So I just want to take a moment to thank and acknowledge the team behind the Health Workforce Data Modelling at the department. It's a Health Workforce Data Intelligence Unit, and they helped put together this nursing supply and demand study I'm going to talk about today. Next slide, please. Okay, so it's really important for a start, to know that the information that we share and enter as part of our nursing and midwifery registration process informs this thing called the National Health Workforce Dataset, which is maintained by the Commonwealth. It's updated every year, and so, for example, the 2023 data was released in August 24, so hopefully we'll get that 2024 data soon. So what I've done on this slide is I've shown you how to get to this data. You go to hwd.health.gov.au, toggle to resources, dashboard, nursing and midwifery dashboards. So this talks to the whole of our profession, so midwife, registered nurses, enrolled nurses, nurse practitioners. And like Lisa was saying, this is where you'll see the total numbers of nurses currently working in Australia. So what I've used on this slide, what we're looking at is registered nurses. So when you go to the web page, you'll see a similar graphic. You can then click on the yellow arrow. So Danny, can you click on that yellow arrow that's beside employed in nursing? So when you click on the arrow, then click again. It'll open up to a little bit more data. So it will show things like gender, age, jurisdiction, and modified Monash, which is how we describe rurality in the Commonwealth. So there's a little bit of detail there, but if you go on and click again, Denny, on the arrow, one more time, it'll open up to like a much more detailed data set. Oh, could you go back one? Yeah. That you can download as well. So this is open to everybody. So this data represents information such as principal area of work, the work setting, the distribution of the workforce, our average hours worked, public and private, and our age ranges. It spans from 2017 until, like I just said, 2023 at the moment. So this data is really important to us at government as it supports how we argue our policy perspectives and the impact of the nursing and midwifery professions. But it's also the basis of this supply and demand study. So next slide, please. So it's not the first nursing supply and demand study that's ever been done. There was one undertaken by Health Workforce Australia in 2012, which predicted a shortfall of around 109 nurses by 2025. The study was then again updated in 2014, and this study forecasts a shortfall of 85,000 nurses by 2025 and 123,000 by 2030. So what's important to know is that the current nursing workforce exceeded those numbers predicted by Health Workforce Australia for 2025. So like as Health Workforce Australia predicted a nursing demand of 358,879 in 2025 and 394,503 by 2030. But in 2022, the total employed in nursing was around 363,505. So it met and exceeded the numbers that we needed for 2025 in our 2022. So it's really important to know that we undertake measures to change these numbers that we see. So the supply and demand study gives us a bit of a story and data that helps us build policy. So an updated supply and demand model was especially important to inform and drive the development of the National Nursing Workforce Strategy, which hopefully you've heard a little bit about, or you've contributed to our consultations. So just wanted you to know, though, that the Chief Nursing and Midwifery Office Division, to which I belong, we work closely with teams in the department to publish this last July. So it's been out for a little while now, so about a year. And there was consultation on how this model was developed. And we spoke to jurisdictional workforce planners, chief nursing and midwifery officers, peak bodies such as APNA. It was reviewed by health economists and other data modelers, and it was agreed that this was a really appropriate model to use. So next slide, please. If you do like data, so this is an interesting slide, but hopefully it won't lose you. But the data we need to inform the supply and demand model comes from a variety of sources. At the end of this presentation, I'll share a couple of our resources, so you can go to them. But of importance, if you like this, there's a methodology paper, but I'll speak through a little bit of how it was done. So the supply data, that's how many nurses are expected to be available. This is sourced from that National Health Workforce data set that I just mentioned, which annually has a greater than 90% participation rate from nursing workforce. And then the demand, which is how many nurses are needed, that data is sourced from the Australian Institute of Health and Welfare. So we look at aged care data and admitted patient data. Medicare Benefit Scheme, so MBS data collection. We look at the Australian Bureau of Statistics, so we use from them the National Health Survey, estimated resident population and survey of disability and ageing and carers. Again, the National Health Workforce data set, you can see how important it is. Then we have the lifetime estimation tool, which includes data from Treasury and the Melbourne Institute of Household Income and Labour Dynamics in Australia. So a lot there. Then microsimulation was used to model. That means behaviour and career trajectory was able to be modelled at an individual level. So how this works is that a sample for the supply of the nursing workforce is built, and then the team observe what happened to that sample of nurses in their career journey over a 5-year period. So we looked at those taking leave, retiring and leaving the profession in the exits. Inflows will allow new registrants, graduates, internationally qualified nurses, re-entry nurses. Then there's the transition assumptions around people who might move between nurse types, jurisdictions and sectors, for example. And each year this is replicated over a forecasted period. And so it's the same for the demand. The data sets were used, and also that light microsimulation population projection. And this projects the size and demographic composition of the Australian population until 2050. So using both of these models and the supply and demand, we get to the results. Next slide, please. But before I show you the results, we just wanted to talk about the good news that we saw in the 2023 National Health Workforce data to say that the nursing profession continues to grow, and you'll see some of these up on the slide now. So there was a 5% increase in employed nurses from 22 to 23. There were 26,303 new nurses who registered in 2023, so that was an increase of over 6,000 since 22. Our nurses who left the profession was slightly down at around 700. Most of our nurses were engaged in clinical work, and FTE increased over the past 5 years across all jurisdictions, so nurses were working more. The challenging data for us at government relates to the 745 nurse practitioners not employed or working as a nurse practitioner. So it's important for us to understand that a little more, and just to ensure that MPs can work to their full scope in the health system in the way that they choose. Okay, next slide, please. Thank you. Okay, so these are some of the results from the supply and the demand study. So what we're looking at now, the graph, it represents full-time equivalent nurses. So like Lisa mentioned, we're looking at that 12-year period out to 2035. We're looking at the difference between the dotted line, which is supply. So remember how many nurses are expected to be available, and the full line of demand, which is how many nurses are needed. So the preliminary baseline modelling output showed that the nursing workforce is on path to supply shortages of approximately 70,707 full-time equivalent nurses by 2035. It's important to note here that this is modelled from a baseline, so of equilibrium. So it didn't start a projection of undersupply, which we're likely at with our nursing workforce. Okay, so below you can see that it's you can see all the different sectors. So for the acute care sector, the projections show an undersupply of 26,665. For the aged care sector, that undersupply was 17,551. Mental health was around 2,000, and there was an other sector for this, and it was just under 3,000. But importantly, we'll go to the next slide, please, Denny. We'll look at the primary care space. So in the primary care health sector, the projections show an undersupply of 21,765 FTE by 2035. Next slide, please. Okay. Just in case you want to see this one too, this is headcount of nurses. So the overall headcount that we need is 79,437. So obviously the number is greater because most of our nurses don't work full time, so headcount. And also, I do have all the numbers for what the headcount is for all the different sectors, but if you go to the nursing supply and demand study, you can get this information specifically. I will just share what the primary healthcare sector is. Those projections show an undersupply of 26,145 by 2035. Okay, next slide. Okay, so seeing the recent 2023 data and that registrations continue to grow, there's lots of positive information. And if we reflect on what happened in our last supply and demand projections, we did exceed the numbers needed for 25. So we're hoping never to get to the point of projected undersupply that I just talked about. And there's lots that can be done to prevent us from getting to that point. And everyone's part of that who's involved in the profession. So what this slide does, though, is shows two nursing supply scenarios that I'm going to talk through. They're completely made up, so there's no policy intent to implement, or could we? But to show you how, if different things change in the system, how this could impact the supply and demand of nurses. So the full green line is our baseline demand that we had already shown. And the first scenario is an example of an early career retention supply. So it's the dark blue dotted line. So if the probability of leaving the workforce for any length of time is halved for nurses 30 years or younger, this will increase the supply and result in a gap of only 56,000 FTE by 2035. So around a 14,000 reduction in the supply-demand gap compared to the previous FTE slide shown of 70,000. Then the second scenario I want to mention is if an additional shift per fortnight was taken up by nurses who work less than 0.75 FTE and are under 65. If those nurses picked up one shift a fortnight, this would result in a supply gap of 50,434 FTE in 2035, which is around a 20,000 reduction. So these aren't realistic scenarios that we can influence in government. So behaviour change, picking up a shift or not leaving the profession is much more granular in terms of personal choice and employer policy, things like that. But they're things that we can model now that we have an updated supply and demand study and model. So what is part of this work is this data projection tool called Heads Up. So this stands for Health Demand, Supply and Utilised Patterns Planning. It's where this supply and demand model sits. And what it does, it enables workforce planners and policy people to run scenarios like the ones I just mentioned on data to test what a policy implementation might look like and how it may impact or change the projection of data. So that changes in the system can be modelled to see what the impacts are and what it does to the workforce. So the supply and demand, it's a tool for all governments to project future shortages and address workforce challenges. However, no single policy can close the gap. However, there's a range of work underway to improve the supply, retention and distribution of the nursing workforce. And like I've mentioned, it does include the nursing workforce strategy, which should be released in the coming months. So the plan is to update the supply and demand modelling every 2 years. If we did it more frequently, we wouldn't see the changes in data. But it gives us a good baseline to start from. So I'll just go to the next slide, please. So to finish, I just wanted to share the related resources for the presentation today. So the first is a web address and QR code that goes directly to all the supply and demand information, including the study, all the results in a spreadsheet, and the methodology paper that I mentioned. The second is a department's Health Workforce Data website, which includes the Health Workforce Data tool that I'll talk through with you, the Heads Up Health Workforce Demand and Supply tool, and then it also goes to the supply and demand studies for other health professional groups as well. Okay, so thank you for your time today. I hope that was helpful information. Yeah, thank you.
Thank you so much, Samantha. Yes, it was, and we've got a few questions for later in the session. So I'd like to now introduce you to Kirsten Moore. Kirsten is our Research and Evaluation Manager who joined APNA earlier this year. She's a social researcher who's worked at the National Ageing Research Institute, the University College London, and the Victorian Department of Health, where she's been involved in research and evaluations relating to primary care, the care of older people, and palliative care. Her PhD and postdoctoral fellowship focused on the wellbeing of carers of people living with dementia, and she's a member of the Australian Association of Gerontology, and also was a triage editor for the Journal of International Psychogeriatrics for 10 years. Kirsten's an honorary associate professor at the University of Melbourne and the National Ageing Research Institute, and she's affiliated with the Nursing and Midwifery at Monash University. Welcome.
Thanks. Thanks, Lisa. Next slide. So I'm here today to talk about some of the findings from the APNA Workforce Survey that we conduct each year, and to contribute focusing on data relating to workforce supply and intention to remain in the nursing workforce. So we do this survey, we've been doing it for nearly 20 years now, and it's overseen by an advisory board that has government, industry and university representation. We also have ethics approval from the Monash University Human Research Ethics Committee. And in 2024, we had responses from 3,058 nurses and midwives across Australia. So this represents around 3% of all primary healthcare nurses and midwives. 94% of our respondents were female, 6% were male. They ranged in age from 21 to 82 with a median age of 50. Most, or 3/4, were registered nurses and about 12% were enrolled nurses. While we have nurses from over 22 different settings, a lot of our respondents, or just over half, were working in general practice. To get an idea of how representative our sample was, we also compare it to the National Health Workforce data that Sam's just been talking about. And we looked at whether or not our sample was similar or different to that overall workforce. So this showed that we had good representation across different rural areas, across different states, and also had good representation of First Nations nurses. We had, however, slightly lower representation of males and younger nurses. So in this recent survey. Next slide. So one of the things we ask nurses is how valued they feel by different sort of people. So the first one, in the first bar here, we can see that around 90% or nearly 90% of nurses feel that they are well valued by their patients, their residents and their clients. They're also highly valued by their colleagues, and slightly lesser so, but also from their managers. But when we look at the government, how much nurses feel valued by government, that really drops down, and we get actually a majority saying that they don't feel valued by government. So that's a really kind of important factor and quite stark contrast there for those different groups of where nurses feel valued. Next slide, please. We also look at intention to remain working over the shorter term, so in the next 12 months, as well as the next 2 to 5 years. And here we can see that 34% of our respondents were unsure or unlikely to remain in primary healthcare in the next 2 to 5 years. So that's quite a significant number. Can you just next? And also, when we look at intention to leave patient care, we also have 15% of respondents likely to leave care in the next 12 months. That's direct patient care. And when we look at whether or not people are thinking about leaving the profession altogether, another 22% are likely to leave the profession altogether in the next 2 to 5 years. So there's quite high levels here across those different categories that we ask in terms of intention to remain. But I want to look at that in a bit more detail and look at how does that relate to different characteristics and different experiences of being a nurse, and that's what I'll look at in some of the next slides. So next slide, please. So as we'd expect, we'd think that, a lot of people would be in their older age groups, particularly those over age 65 and possibly those in their late 50s, early 60s, might be intending to leave nursing profession due to retirement. And so we just wanted to double check this and make sure that those findings were evident in the data, and we can see that definitely those 65 plus age group are much more likely, or much more lower likelihood of remaining in primary health care, and much more likely to be leaving direct patient care. However, what we found a little bit more sort of worrying or a bit more interesting was that when we look at the intention to leave direct patient care, that younger age group of nurses, 20 to 34, were actually more likely to be considering leaving than the nurses in the 45 to 54-year age group. So, it's quite a worrying sort of trend that of nearly half nurses in that age group intending to leave direct patient care in the next 2 to 5 years. Next slide, please. We also consider whether or not working to full scope of practice. As you'd expect, those working to full scope of practice might feel more like they're enjoying their work more and be more likely to remain within the workforce. So just to orientate you to this slide, the first bar is around shows all the nurses who are regularly working to their full scope of practice. So we can see that 71% of those who are working to their full scope of practice are very likely or likely to remain in primary healthcare nursing over the next 2 to 5 years. However, when we get to the other end of the bars, where we're looking at those who are rarely working to their full scope of practice, that picture changes, and we get only 53% who are intending to remain in primary health care. So we can see there a bit of a relationship between intention to remain and the extent to which nurses are working to their full scope of practice. Next slide, please. We also looked at job satisfaction, and we used a job satisfaction scale that gives a score out of 6, so 0 to 6, where 6 indicates that someone's got high levels of job satisfaction. And overall, we can see that nurses are reporting high levels of job satisfaction. So 5.4 was the average across all the nurses responding to this survey. However, again, when we look at intention to remain, we can see that those who are likely to remain in the next 12 months and 2 to 5 years are reporting higher levels of job satisfaction than those who are unsure or unlikely to remain. So we can see again that idea that if those are more satisfied in their job, as we'd expect, have sort of higher intention to stay. Next slide, please. So another thing we look at is around whether or not nurses are getting support for continuing professional development. And this bar shows that the right-hand column shows that a large proportion, nearly, just over a quarter of all nurses in the last 12 months had not actually requested any support for CPD. But amongst those who had, overall, it adds up to be 40% of those who requested support always or mostly receive support. So in fact, the majority of those who are asking for support are not getting the support that from their organisations or their employer to undertake that CPD. Next slide, please. Next slide, please. So just in summary, We can see how useful this data can be, providing a rich understanding of motivations and experiences of primary healthcare nurses and midwives. And so just a reminder and an encouragement to complete the survey if you see that in your inbox at some point later this year. And just a summary of what this data is telling us is that respondents are feeling highly valued by their patients and clients and residents, but not so much by government. Around a third are unsure or unlikely to remain in primary health care in the next 2 to 5 years. As we'd expect, the intention to remain is lower for nurses over the age of 65. But also interesting was that 20 to 34-year age group that are also sort of reporting nearly half of them are considering leaving direct patient care in the next 2 to 5 years. As we'd expect, intention to remain working was higher amongst those who reported higher job satisfaction and were often working to their full scope of practice. And we're also seeing that the minority are getting support for their CPD. So this really gives us some important information around to sort of identify how we can attract and keep nurses in the nursing workforce. Thank you.
Thanks so much, Kirsten. That was great. Next, I'd like to introduce you to Andy van der Rijt. Next slide. Thanks. Andy's the Service Delivery Manager at Health Workforce Queensland. He's dedicated to enhancing health outcomes for rural and remote communities in Queensland, drawing on a diverse background in leadership roles across various industries, including finance, health and recruitment. Andy leads and supports the team to increase access to and retention of health professionals in the communities that need them most. So welcome, Andy.
Thank you, Lisa, and thank you for the opportunity to speak today. Can we go to the next slide, please? Thank you very much. So I'll start by acknowledging the First Nation people as the traditional owners of the land on which we meet today. For me in Meanjin, Brisbane, that is the Jagera and Turrbal peoples. I pay my respects to elders past, present and emerging, and extend that respect to all First Nations people online today. So if we go to the next slide, there's a little bit of a snapshot about who we are. We are Health Workforce Queensland. We are one of the 7 rural workforce agencies in the country. So we've got one in each state and territory. And we're all about making sure people in rural and remote Queensland access the healthcare they need and can access the healthcare they need when and where they need it. And our job is to make sure health professionals like yourselves have the support they need to thrive in the communities that need you the most. So we do that by helping with recruitment and retention, offering professional development opportunities, supporting students, and working with local partners to plan for future workforce needs. There's quite a wide variety of initiatives and programs that we manage, and today I'll just highlight a few of them that I think are most relevant for the audience today. So if we can move to the next slide, we'll start with our flagship student program. That's named Grow Rural. So Grow Rural is our end-to-end workforce solution that provides a multidisciplinary cohort of students with the annual opportunity to experience what it's like to work and live in rural Queensland. So that commenced in 2017 as a immersion program in central Queensland, and since evolved to an end-to-end rural workforce pathway, which I'll explain the difference in a little bit. We've got active cohorts currently in North Queensland in the Tablelands, as well as in the St. George, Roma and Charleville in Southwest Queensland. And we couldn't do this without the partnerships that we have with the PHNs, universities and local providers. So if you move to the next slide, there's a bit of a snapshot on the key elements. So starting with the Grow Rural weekends. So from the very first year, health students get a chance to spend a long weekend each year in rural community, where they stay with local families, learn hands-on skills from local practitioners, and get involved in social community activities. So it's not just about learning skills, it's about relationships. The students build strong connections with local clinicians and their peers, and the community plays a really big part in that experience. So that's where we used to stop. So in 2017 and 2020, for those 2 cohorts, we did the rural immersion weekends, and we kind of hoped that the students will then choose a rural career. But we've really looked at the research, and the more touch points students have with the rural community, and the longer the touch points are, the more likely they are to take up a rural career. So we incorporate the 4 other elements there as well. So we now work with the universities and really try to encourage the students to go back to the same communities again for their clinical placement. And the results so far have been really, really great. So a lot of the students are taking up that opportunity, which is amazing. And we offer some support for their travel and accommodation there as well. Then we've got our Health Workforce Solutions team that has developed a series of touch points throughout the program as well. So webinars to help them with career preparation, career advice, and they also help transition students into their first job as a new grad. And then, of course, we work with the practices as well locally to sort of get them ready to welcome and retain a new grad. So it's really a whole of community approach to growing the future workforce. So if we move to the next slide, there's a little bit there about the outcome so far. It's still early days. The new model only started in 2022. So the students on those 2 cohorts, they're graduating this year or graduating in the next couple of years, depending on their discipline. But what we did is we had a look at the students of the cohorts in 2017 and 2020, and we've got a longitudinal study going. So we basically send them a survey each 2 years to see where they are, and we track them via APRA as well, via the registration. And it turns out that of those 2 cohorts, the students that went through the program were 2.6 times more likely to be practicing rurally compared to the students that applied for the program but weren't successful. So we can really see that the program there is working. And yeah, we're really hoping on even better results now that we've incorporated those other elements as well. We're really hopeful that the retention will be better as well, as we've just heard that retention with health professionals and nurses in particular is a big issue. So, you know, we're hoping to really set these students up for success. So they will have really strong networks in the community, that it's like they're coming back to a place where they've, you know, visited 3 times over. They know the practitioners there. They know the local council. They hopefully some of their peers are joining them in as first grads as well. So we're going to keep a close eye on the retention rate for those students as well. One really important factor in helping with those relationships and the connections that they build with the community is the Health Workforce Connector. So each of the GROW cohorts, if we move to the next slide, has a Health Workforce Connector locally based. So they are someone who lives and works in the region, and they act as a bridge between students, health professionals, universities, and the community. They have an extremely flexible and role that is tailored to the needs of each of the communities. They do anything like helping with the Grow Rural Immersion weekends together with our future workforce team. They have really strong relationships with the universities and the placement coordinators there, and they help with career pathways together with our recruitment team. They also provide a Settle and Connect concierge service, which kind of means that once these students become new grads and they take up a career into the area, the connector will help them sort of integrate into community as well. And that extends beyond just the students going through the GROW program. That is also for new grads just coming from other through other programs or just through direct recruitment in the area as well. And then importantly, they're also helping to grow the next generation of rural health professionals by engaging with the local high schools and promoting health careers early on. So it's not just about filling the jobs, it's about building a sustainable community-driven workforce for the future. If we move to the next slide. So that was basically what we do. Well, one of the initiatives that we have to get students attracted. But obviously, as a rural workforce agency, recruitment is really our remit. So we have 4 lovely regional coordinators in the state that can help you find your dream job. As you might have noticed, I've sort of tried to strategically present the slides with all the beautiful landscape that you can find here in Queensland. So if any of you feel enticed to come and live and work in the area, please reach out, because our team is very happy to help. And depending on where you want to go, We've got some incentive packages and some relocation assistance available for you as well. And also, once you've been placed, we can offer some CPD support. We've just learned in the previous slides that that's very important to try to work top of scope for your retention as well. So if we've moved to the next slide, there's a bit of information there about a program that's called the Health Workforce Scholarship Program. Some of you might have already heard about this. This is a federal funded national program. So each of the RWAs administers that for their state. And basically, it provides bursaries and scholarships up to $10,000 for anything from short courses, workshops, conferences to postgraduate qualifications. And the travel and accommodation paired with that is also available. So it's as you might imagine, it's a heavily oversubscribed program. Sadly, we need to say no to a lot of people each round. So what we've done is we've developed a methodology where we prioritize professions that have the biggest community benefit. So we look at things like, are you working for a community controlled sector? What are your working hours? How rural are you willing to go? And all those kind of things. Nurses are one of the priority professions. So I had a quick peek this morning, and I think in the last 2 financial years, we've had about 100 nurses apply successfully for this program in Queensland alone. I think there's a round coming up in 7th of July. So if you are looking at upskilling yourself, please have a look at the website and have a look at the eligibility criteria. And I implore you to apply for this. And then lastly, the last slide, there's another scholarship program, but then specifically to the NQPHN region. So this is a collaboration between us and the North Queensland PHN. And that is specifically for maternal and child health upskilling. So anything to do with the first 1,000 days of life. And what I really like about this program is that the funding is quite flexible here. So the scholarship program is limited to course cost, travel and accommodation, but this program can actually fund any barriers that you might have to uptake training. So we funded things like childcare for people that couldn't afford the childcare and go and do their upskilling. Even loss of income due to having to do a clinical placement. So it's super flexible, and we review each application sort of as a case by case. We've extended the contract with NQPHN for another year. So if you're in the NQPHN region already or keen to go there, please reach out, and we're happy to help you support you with the upskilling there as well. I think that brings me to my last slide. So I've had to rush through it a little bit, but if there's any, if you've got any questions or you want any more information, all these programs are available on our website as well. And if the slides weren't enough to entice you to come and live with us in Queensland, then hopefully you come for a visit next month, actually, because the APNA Festival of Nursing is on in Brisbane. So we hope to see you there as well. Thank you.
Thanks so much, Andy, and such great work happening. It was fabulous to hear about it. And next, I'd like to introduce you to Linda Govan, who's our Nursing and Primary Healthcare Senior Program Manager here at APNA. And in that capacity, Linda's focus is on implementing a program that seeks to support primary healthcare nurses to establish nurse clinic models of care. This includes the development and implementation of a comprehensive evaluation to understand the factors that support the delivery of efficient and effective nurse-led models. As a former registered nurse with accompanying qualifications in public health and health administration, Linda has a broad range of experience across the health sector with a focus on primary healthcare settings. So welcome, Linda, and over to you.
Take it away. Thanks, Lisa. Good afternoon, everyone. Great to be here. I'm on Wadawurrung country here in Victoria, and the sun is out, which is lovely. Next slide. Thanks, Danny. I'm going to talk to you about two, flagship programs we've had at APNA now running for almost 10 years, supported by Commonwealth funding, our Transition to Practice program and our Building Nurse Capacity program. And then I'll move on and talk about a new program that we have about to launch, our tailored education for multidisciplinary teams. And these all are focused on either recruitment and retention of nurses in primary healthcare. Next slide, thanks. So I'll start with our transition to practice program. This is designed to support to recruit and retain nurses in primary healthcare. It's focused on nurses who are either early career and considering moving into primary care, or they've been registered for any number of years and are considering moving their career into primary care. So it's a structured program. It runs over an 8-month period, and there's a lot of education and support there with workshops and online learning opportunities. There's also mentoring, which is a part of the program as well, one of the key parts of the program. Next slide, thanks, Danny. Some of the impacts of the program that we've seen in regards to retention within the program itself. From the most recent cohorts that have gone through, we've seen 89% of nurses completing or are completing the program. And in regards to asking the question about their intention to remain in primary healthcare over a 6 to 24-month period, we're hearing or seeing that the nurses are 76% of nurses are intending to stay in primary healthcare. Its impact on career progression is also, we've also seen nurses who have moved to become mentors from their role as transitioning nurses. And we've also seen a number go on to gain nurse practitioner qualifications as well. Thanks. Next slide, Danny. The Building Nurse Capacity Program, it's around the implementation of nurse-led models of care, or nurse clinics for short, because it's easier to say that. The main objective of the program is to build the capacity of the primary healthcare team by optimising the role of nurses in care delivery and to provide a supportive environment to make that happen. And we also know that the program enables nurses opportunities to step into leadership roles and to increase their confidence to work to their full scope of practice. And I'll go into that in a little bit more detail. Next slide, Danny. As you can see there, the spread of clinics purely for our building nurse capacity work, we've supported 99 now, but 99 clinics over almost the last decade around Australia. And you can see on the slide the range of focuses of the nurse clinics there, from cancer screening, cardiovascular disease, healthy ageing, women's health. We've seen an incredibly large array of clinic types and nurses doing amazing things. And if you have an opportunity, and we'll put the link in the chat, have a look at our nurse clinic website to see some of the case studies that we have. And we continue to learn a lot about from the models and get to work with some amazing nurses in this work. Next slide, Danny, thanks. Awkward silence, but I can talk to the impact of the program. Here we go. One more. Thanks, Danny. Fantastic. So what we see, we have quite a rigorous evaluation of the program. The results here are from the program that finished in June 2023. We saw on average the nurses who completed the program had, in regards to their knowledge, skills and confidence, scored, the average was 8.9 out of 10 in regards to those features. We also saw increases across the 5 domains related to advanced practice. We use the Australian Advanced Practice Self-Assessment Tool, and it looks at the 5 domains, which includes clinical care, optimising health systems, education, research, and leadership. And what we know, both from our experience as well as what's in the literature, is that nurses who are enabled to work to their full scope of practice experience higher levels of job satisfaction, increased independence, autonomy in their role, and it impacts positively on their intention to stay in nursing. And we also know that nurse clinics themselves increase access to healthcare, improve health outcomes, and improve patients' experience of care as well. Next slide, thank you. Just in regards to the results that we did receive from the advanced self-appraisal tool, you can see there the change in that's pre and post for the group that went through in 2022 to 2023. So we see some really good results of being involved in the work that we do at APNA. So we're really pleased about that. Next one. Thanks, Danny. And we also know, and these are from the group that's currently going through, and they'll be going, the majority will be going through until September this year. They'll be with us, they've been with us for almost 18 months now. And we know that having opportunities to be involved in these workforce development type programs really does have a positive impact, both on their job satisfaction and on their intention to stay in primary healthcare as well. Thanks, Danny. The final program that I wanted to speak to today is a new program being offered by APNA. The previous two, the Transition to Practice and Building Nurse Capacity, is supported by Commonwealth funding. This program isn't. It's supported from other funding streams, whether that's from the PHN or the individual organisations. But the focus of the TEMP program is really to build the capacity of the multidisciplinary team from both a clinical and business perspective. So there's a focus on the development of better care planning, better care planning, financial viability, understanding what are those factors that support sustainability and viability around business models as well. And so it's going to provide a really rich networking opportunity for nurses, for practice managers, business owners as well. So we're really excited about this new program. The first program is due to kick off in July with a focus on chronic disease management. And again, we'll have a link in the chat to some more information. But next page, thanks, Danny. In general, the program is going to run over an 8-month period. There's a mix of different learning opportunities, from webinars. There'll be a community of practice. There'll be phone support from the APNA team as well, and lots of resources. So again, QR code will be in the chat if you want to have a look in more detail, and we'll also put the email in of Issa, who's looking after this program as well. So thank you. Thanks for your time today.
Thank you. Thanks so much, Linda. Some great work being undertaken and moving forward with to improve retention and recruitment into primary healthcare. Fabulous. So thank you all for submitting your questions during the webinar. I noticed a couple of people have used the ordinary chat, but we'll try and get some through some of these. Thank you. Sam has already answered a couple, but I have another couple for you, Sam, if you've got a moment. There's a question here. I also note that aged care, health promotion, community, aged care and primary care are treated as different or separate sectors, but APNA views all of these as primary health care. Would it strengthen our asks for funding and policy advancement if we put these all together, as these are not all acute? It would help with workforce planning, I would think. Oh, yeah, you've already answered.
Well, I was a little bit worried we weren't going to have time to do the question answers at the end, so I started to answer. But yeah, so there was a bit confusing because I did talk about the health workforce data set, which is this like big data set of information, and that's broken down into different like I talked about, like principal area of work and things like that. And then there's a supply and demand study, which did concentrate on those 5 different contexts of practice. In the supply and demand study, it does describe what is included in the primary care definition. But yes, you could look at that big health workforce data set and really drill down and look at the context that you think could be captured within your context to build the numbers, and then of course support your ask. So yes, you can. So they are a little bit different. So, and please go in and have a look and explore the data, and reach out to, there's a email address there. You can ask questions. We get questions all the time about data to help with things. So feel free to send it through, or send through to me, and I can help the RC Intelligence Unit.
Okay, that's great. We'll be able to provide that to participants when we send out some stuff. We also had a number of comments or questions in the general chat around just trying to understand a bit better how you determine the demand of primary healthcare nurses. Like, what does that reflect? Could it be nurses? Do you have any information around what it might be reflected in their wages or things like that. And I know you probably don't have that information. I've looked at some of the work that is in there, but there were several questions sort of just questioning how the demand is determined. And I think you did touch on it in your presentation, but maybe if there's a simple way that you could explain to the participants around that.
Yeah,
We can take it offline if it's easier and do it later, but yeah.
Thanks, Lisa. Yeah, I did see the questions, and I think it's really important probably to help clarify as well. I don't
Yeah.
think I have an easy answer for you today because it is complex and it uses multiple data sources.
Yeah.
The methodology paper that I mentioned, and I provided a QR code scan to, does explain it in more detail, obviously.
Yeah.
And I think it may be worth raising with the intelligence unit if there's an easy way to explain it, so that it can sort of be justified to the workforce. So it might be something I can take away and come back. And obviously, the methodology paper does go into a lot of detail though, and I'm not across all of it, so I apologise.
Yeah, no, that's fine. It's a huge piece
great
of work.
question. So
yeah, that's right. So it makes it it would make it easier if it could be explained a little more simply, maybe. It is hard with so many data sources. We've had a lot of comments as well around Andy, fabulous programs. I hope you don't steal all of our workforce from here in Victoria. And although I wouldn't mind coming up. I think we'll leave that there. We do have some other questions, but in the interest of time, we've got a couple of minutes. Linda, there's a question here for you. What do you see as the most significant challenge for nurses wanting to establish a nurse clinic?
Thanks, Lisa. From our experience with the nurses and the clinics that we support, it would definitely be around funding availability for nurses, and there's no secret there. Often when we start a new project, one of the first questions is, what are the nurse clinic item numbers? And it's like, well, there aren't any. So it's really a conversation around how do you build the funding model into the MBS items that you have? How do the nurse activities drive MBS billing? So we do a lot of work around financial viability and modelling. Thanks, Lisa.
Thank you. Okay, so I would just like to close and thank all of our speakers, panellists today. They've done an amazing job, I'm sure you'll agree. I'd love you to please join us for our next webinar, which is on Wednesday, the 17th of September at 1 p.m. for the final of our 3 Primary Healthcare Nursing Insights webinars. The registration link will be made available in the chat, or it has actually already been made available in the chat. And I thank you. Please have a fabulous rest of the week, and thank you again for your time. We know it's precious. Thanks so much. Bye.